Salam alaikum, bonjour, hello, and I apologize that I have to speak in English because despite the fact that my parents came from Morocco, from Tanger, from the north of Africa, I was born in Berlin and I am currently the director of the Department of Gynecology and the Center of Oncology, and I'm so proud to be part of this wonderful i-STARC project, to be in dialogue with all you experts and to bring best treatments to our patients. And I'm part of the faculty, and even I will be responsible to educate the youngest researchers and doctors, and I'm really proud to be in the heart of this team. How to diagnose women with cancers? What is the best surgical and medical treatment? And what is the best approach for cancer care? That's not a regional question, that's not a national question, it's a global health issue. And that's the reason why i-STARC is so important and relevant, to bring all nations, Mali, Morocco and Germany, in a dialogue to find the best individualized treatment and to invest their energy in educate the doctors, the nurses and all the other medical professions. That's my vision, that's my responsibility, and I'm proud to be part of this. I'm a global citizen. Despite the fact that I was born in Berlin and my parents came from Morocco, so we have a responsibility to think about the global treatment of women, because women care is one of the quality indicator for every healthcare system. And that's the reason we have to build bridges between the nations in cultural, in scientific aspects, but even in the idea to bring the best diagnostic and treatment approaches to our women. And that's the reason why I personally so engaged in this i-STARC project, and I'm so proud to make this visible with the support of the national authorities, but even from the industry and all the other partners, to bring better diagnostic and treatment to our patients. Thank you very much. Shukran. Merci beaucoup.
Hello, I'm Dr. Sarah Nasser. I'm a gyne-oncology fellow at the Charité Hospital in Berlin, and I'm the project lead of the i-STARC project. The i-STARC project is going to be the main driving force for women empowerment in healthcare in the African region. It's going to build and form networks which are sustainable in cooperating with women who have gynecological cancers and ultimately improve the healthcare. This project is very close to my heart and I have a lot of passion for it. I myself come from a multicultural background, and I'm a woman in medicine and in research and surgery. So woman empowerment is something that's very close to me. One of the hallmarks of my own happiness has always been forming close and meaningful connections. And within the i-STARC project, we will form close, meaningful, and most importantly, sustainable connections.
I'm Andreas Kaufmann, I'm a biologist and I'm heading a research lab at Charité Clinic for Gynecology. We have worked in low-income countries a lot for implementation of cervical cancer screening, and in frame of i-STARC, my task will be to give webinars and to implement studies, investigate how best to implement cervical cancer screening in low-income countries. i-STARC is an exciting program to bring knowledge to countries where there is a lack of knowledge, and we will be especially interested in tumor biology, tumor treatment and tumor prevention. For me, it is important to report and to teach about cervical cancer. Cervical cancer till today is the second most leading death of cancer in low-income countries, including Mali and Morocco. And we have the tools to prevent the disease. So with i-STARC, we have a tool to transport, to teach about the disease, about prevention, and about treatment. For me personally, it is extremely important to reach out to women in Africa, in developing countries, who die unnecessarily from a disease that can be easily prevented. I have dedicated my life for this task.
My name is Andreas Ulrich. I'm a medical doctor and a specialist in global health. I have worked for 20 years for the World Health Organization, and I've now the privilege to work with Charité, Department of Gynecology and Gynecology. I'm advising the team of Professor Sehouli, Dr. Sarah Nasser, on global health with focus on women cancer. Taking my experience with WHO and my links with the International Geneva, the UN organizations are based in Geneva, and they all work together on health on women cancer. It is important because cervical cancer in women is a cancer which is completely preventable and treatable. No woman in the world would need to die from cervical cancer, however, completely unnecessary. So I'm very happy that Charité has taken this as a subject of expertise, of knowledge exchange, and we have focused on Mali. I'm very pleased because it's a French-speaking African country, and I'm French-speaking, so I'm really very pleased to work with my friend and colleague, Professor Tegete, to implement the project in terms of increasing the capacity of Mali to manage cervical cancer, so that women survive, get better treatment, and have a better quality of life. It's for me personally a satisfaction because I have guided WHO also 20 years to get cervical cancer as a priority, and now it's there. And now I'm working with Charité to implement the strategy. So it's for me personally also a great pleasure to be involved in that endeavor.
Hi, my name is Niki Katsara and I'm 21 years old. I come from Greece and I currently live in Berlin and study at Charité as a third-year medical student. My role in i-STARC will be to assess the impact of the digital tumor boards and webinars on the management of patients suffering from gynecological cancer in Africa, but also the impact on the management on the further medical education of the healthcare providers being involved in the i-STARC project. Now, i-STARC may at first sight seem just as another attempt for two parts of the world to collaborate or to improve the prognosis of oncologic patients, but it is actually way more than that. i-STARC takes what is now a gold standard in the clinical oncologic procedures, a tumor board, and makes it digital. And not only within a hospital, like a new software that will allow different disciplines in a hospital to collaborate, gather data, and make patient management decisions, but it involves different hospitals, different countries, different continents, different medical approaches. It basically challenges what it means to be a healthcare provider in the 21st century. It brings up the question of the accuracy of current global and national health policies. And of course, it captures real-time decisions on the management of women suffering from cancer. What has always fascinated me, even as a child, is how from a simple cell, an amazing creature can be brought to life, and how from a small change in that cell, the life of the creature could be taken away. Now, this change, cancer, has been in our lives for quite some time now. And I think we've all more or less been exposed to the organic, functional tragedy it brings with itself. It's high time that we had a collaboration like this to do all of that at the same time throughout the world. You know, I close my eyes and I picture this, and this is my vision. This is my i-STARC.
Hello, my name is Karim Loreti. I'm the project coordinator of i-STARC, and I'm also responsible for digitalization, public relation and communication. Yeah, I think i-STARC is very important in general to connect not also people and companies. It's more important to connect knowledge. Knowledge should belong to everybody and not only to some of us. And so I think the i-STARC project is one solution to connect people with companies and also with knowledge. For me personally, i-STARC is very important as a half Italian and half Egyptian who grew up in Germany. It was always a challenge for me to handle with different cultures. For me, it's very important that we learn from each other on the same level, and that's the thing what's very important for me, that we are on the same level and that we learn from each other and the exchange on the same level.
Hello, I'm Moritz Pfoch. I'm a medical student at the Charité University of Medicine, Berlin. I got to know about i-STARC at my student research project. My aim at i-STARC is to find an effective and easy way to monitor the growth of knowledge through webinars. The digitalization brings a big benefit in many parts of our life, in the economy and the social life, but also in the medicine. And to ensure this benefit isn't only for countries with well infrastructure, there have to be projects like i-STARC. As a doctor to be, I am searching for a way to do with my work as many good as possible and help much people. And I don't know in which project I could do this better than an i-STARC.